Made big promises in the first federal budget in 2 years, including drastically bringing down the cost of childcare.
It's expensive. It keeps going up every year.
The Liberals promising to relieve the childcare burden on working parents by investing billions of dollars in a nationwide childcare system. What will this mean for parents in our city? Plus,
just hopefully today we can get it. We're happy. That's it.
long lineups, overnight waits. People are doing whatever it takes to get a vaccine shot as the city expands mobile and pop-up clinics in hotspots while offering the AstraZeneca dose to more age groups. And
the province is going to a hell in a handbasket.
the fallout continues following the Ford government's latest restrictions and restriction reversals. How cabinet ministers are responding to the unrelenting criticism over their handling of the third wave. Good evening, I'm Kelda Yoon. The Liberals unveiling its federal budget today, promising to spend more than $100 billion over the next 3 years to help rebuild the economy and address inequities laid bare by COVID-19. And one of the biggest highlights, childcare. After decades of broken promises and half measures, the federal government says it will put in place a national childcare program, a big deal for many families in the GTA, where the cost of childcare is higher than anywhere in the country. Our Chris Glover has been checking in with some parents tonight. He joins us now. And Chris, how are they reacting to this?
Kelda, the parents that I've spoken to tonight say that they are thrilled with this plan, and the business community here in Ontario and the GTA say that while this looks like a critical social program, it's also critical to the economic recovery of the country. Ask a GTA parent about childcare costs and you'll probably get a face like this. How much was it?
It's expensive. It keeps going up.
Cindy Brotto is able to work while putting her 3 young kids through daycare, but she knows other moms can't do it.
It shuts people out of that opportunity. So I think it just probably would make things a little bit more fair.
In today's federal budget, the Liberals pledged a national daycare plan. By 2026, the goal is an average cost of $10 a day. Growing up with a single mother, Laura Bonifaz can only dream of its impact.
If we had something like that when we were younger, I think we would have been a lot more better, well off. But I think it's amazing that the government is doing something like that.
The budget document shows 7 of the 10 most expensive Canadian cities for daycare last year were in the GTA, with Toronto topping the list at more than $1,500 a month. The Ontario Chamber of Commerce says the economic impact of the pandemic disproportionately forced women out of the workforce to care for kids.
If you were going to invest in one social program with the highest return on investment, that's absolutely the one.
We have had so many tries. We were very close.
This early childhood education professor from Western University says in 2005, former Prime Minister Paul Martin got the closest to a national child care program, but was thwarted when his Liberals lost re-election. She likes that this plan replaces for-profit child care.
They will be able to engage in education rather than just in a service that takes care of young children.
The Liberals' plan would cost $30 billion over the next 5 years and then more than $8 billion a year after that to keep it running.
I support that. Even my daughter doesn't need daycare, but I think because I remember when my daughter was little, it's pretty hard.
Even though Leo Liu's daughter is 8 and he won't benefit from the program, he's still on board.
In the future, you don't know, because my daughter grew up, she has a kid, she needs daycare too.
Now, Chris, a lot of our audience will pick up on the fact that childcare, like healthcare, is actually a provincial responsibility. So what is the province saying about all this tonight?
Well, in fact, Kelda, in order to actually get to that $10 threshold, the provinces will have to kick in some money into this program as well. So I reached out to the province, and Education Minister Stephen Lecce said that he welcomes the additional support from the feds for childcare, but he says that he's worried, especially around the one-size-fits-all approach. That's what he said, and he's worried about it fitting the unique needs of every parent here in Ontario, but he said that the province is willing to work with the federal government on this issue.
All right, thanks, Chris. That's our Chris Glover reporting live for us tonight. This year's federal budget covers a lot of ground. We break it all down on our website. Just head to cbcnews.ca. Almost 1 million doses of COVID-19 vaccine have now been administered in Toronto, while the province is close to hitting the 4 million mark. This comes as people as young as 40 can now book an appointment to get the AstraZeneca vaccine at pharmacies. The city is also expanding mobile clinics to hotspots across Toronto and Peel. As our Angelina King reports, thousands are braving long lines to get a shot.
There was no hesitancy at this pop-up clinic in North York, with people lining up overnight just to get an appointment card after some tried to get their shot the day before.
Just hopefully today we can get it. We're happy.
We wanted to get ahead of the line, and that's why we decided to come at midnight.
The lineup for AstraZeneca, a different story. The province says lowering the cutoff age to 40 from 55 was made based on current supply. Pharmacists reported unused doses. Dr. Isaac Bogosh says that's partly due to hesitancy in the 55-plus crowd, something experts are working to address.
You still have to have an honest, open, transparent conversation about the low, but of course not 0% risk of a blood clot. But let's contextualize risk for a minute. I mean, we're in a very tough spot in Ontario right now. You've got a potentially life-saving vaccine that'll help you, your family, and the community around you. And you can literally walk down the street to get it. You should probably go get it.
Some in that lower age group are ready and willing.
As soon as I had that opportunity, I gave it a try.
Don Pierre Napuli didn't waste a second. He booked his appointment right at midnight. A huge relief, he says.
Because my girlfriend is actually a healthcare worker, and it's one of those things where, what if those opportunities that chance that she were to come home and bring something.
But some weren't as lucky.
I was pretty excited. I didn't expect it to happen this early.
But David Silverberg will have to keep waiting. With his phone service down, he couldn't book with a certain major pharmacy in Toronto, which needed a phone confirmation to do so. Now he's on the wait list at 4 others.
Like all of us, I just want to have that peace of mind of being safe as much as one dose will have me be safe.
As of yesterday, more than 3.9 million doses have been administered in Ontario. More than 346,000 people are fully vaccinated. The province has given out about 80% of the doses it's received thus far. Yesterday, nearly 67,000 vaccines were administered, the fewest in 2 weeks. The average over the last 2 weeks is 97,000 per day, well below the province's target. Dr. Bogosh says lowering the age for AstraZeneca should help boost those numbers. So would allowing more family doctors and nurses to administer all vaccines.
They can talk to patients. They can chat about hesitancy. People feel comfortable going to them. People trust them.
Dr. Bogosh says that would be especially helpful in neighborhoods like this one at Jane and Driftwood, where a lot of people experience social and financial barriers when it comes to getting vaccinated. Angelina King, CBC News, Toronto.
6 people in York Region who believed they were receiving the COVID-19 vaccine were injected with saline instead. Mackenzie Health says the 6 individuals visited its vaccination clinic located at Carlucci Vaughan Hospital on March 28th. A saline is used to dilute vaccines before use and is not harmful. Still, Mackenzie Health says this should not have happened, and they sincerely apologize for the error. Our meteorologist Colette Kennedy joins us now with a first look at the forecast. And Colette, we are bracing for some April snow.
Thanks, Kelda. I don't want to bury the lead because you may have heard a little bit about the possibility of some snow. We are going to get into that, but kind of first things first. Beautiful day, then the clouds starting to push in late day after all that sunshine, and now we've had this cold front going through. So the wind's picking up and some of these scattered showers that we've been seeing along that front as it passes through. Now into tomorrow, we're still looking, although it's drier, at quite a bit of cloud cover left behind. We'll have some sunny breaks in there, but that cloud cover pretty thick into southwestern Ontario. And what also happens here is we're going to see the development of this next system, which looks like it's tracking more to the south of us, and that means that the Niagara region may be seeing 3 to 5 centimeters of snow, but likely it's just a glancing blow, this time south of the 407 towards the lakeshore, where we could get a little bit of light activity there. I'll go into that in more detail coming up. 2 degrees tonight, 8 degrees, a departure from today's high around 17, Kelda.
All right. Thanks so much, Colette. A bird's eye view of one of Ontario's new restrictions. This is the border between our province and Manitoba. Police checkpoints went up there today. Now in Ottawa, police officers are now stationed in all 5 bridges to Quebec as part of the Ford government's plan to stop the spread of COVID-19. The Ford government has been facing an onslaught of criticism over the past few days for its latest response to the 3rd wave of the pandemic, from frustration over the restrictions that were announced to anger over what isn't being done. As our Queen's Park reporter Mike Crawley explains, the Premier's cabinet ministers defended their actions today.
Outside Queen's Park, a lovely day with flowers and cherry trees in full bloom. But inside, behind these stone walls, signs of a government in crisis mode.
Have we been perfect? Absolutely not. We will not, and we will continue to make mistakes.
The latest mistakes? Closing playgrounds that no public health experts suggested they close, and giving police arbitrary powers that even the cops didn't want, only to reverse those plans after an outcry.
I'm not going to disagree with you. It wasn't our best weekend communication-wise.
No glimpses of Premier Doug Ford here today. He didn't hold a news conference and was not in question period to defend his government's tactics.
Lives are at stake in our province. People are dying of COVID-19. Will the Premier finally admit that the measures he announced Friday were the wrong measures?
In fact, we have been taking the advice of the medical experts since this pandemic began.
We've all seen those photographs of people who continue to ignore the advice of the science table and the stay at home. And the intention was always to ensure that those large public gatherings were stopped.
As the COVID death toll rises, the government is under fire for not taking the steps that its own scientific advisors have called for, such as shortening the list of essential workplaces and mandating paid sick days.
The province is going to a hell in a handbasket.
The Liberal leader is even calling for the Premier to resign.
It is abundantly clear that Doug Ford has lost the trust of the people of Ontario. He does not have the skill set, the capacity, or the interest, frankly, to get Ontario through this COVID-19 pandemic.
There was talk that the government intended to shut the legislature down this week, but the Conservatives are denying that that's the plan. Queen's Park is scheduled to sit through until early June. Mike Crawley, CBC News, Toronto.
The province may have reversed its decision to close playgrounds, but it is standing firm when it comes to other outdoor recreational facilities, such as soccer fields and basketball and tennis courts. It says closing these amenities will help prevent large gatherings, but many in the city just aren't having it. As Greg Ross reports, they say they prefer to listen to health experts, many of whom say it's safe.
The tennis courts at Trinity Bellwoods Park were not only open today, people were getting some use out of them, despite the latest lockdown restrictions from the Doug Ford government.
Tennis is the ultimate, COVID activity. You need one person, you're so distanced.
We wear masks pretty much right up until we get onto the court.
This is one of the few things we have to sort of get any sense of enjoyment or, be able to get out of our houses and just have some activity.
Getting out of the house for physical activity was precisely the reason given today by Health Minister Christine Elliott when asked about the province's decision to reopen playgrounds for children.
We have heard from people that they're very concerned about children being able to go out and get some fresh air and exercise. And so the playgrounds remained open. They will, of course, stay open.
But she said the decision to prohibit other forms of outdoor activity was based on advice from health experts.
What we were looking at was all measures where groups of people could be gathered, and that could be in parks, that can be groups of people playing certain types of sports where there's close physical contact.
But many health experts don't agree.
We're over a year in, we know where the vast majority of virus is transmitted, and it's not in outdoor settings.
Infectious disease physician Dr. Isaac Bogosh, who is a member of the province's vaccine task force, believes as long as people take proper precautions outdoors, they're safe.
We should be encouraging people to be outside as much as possible. It's good for mental health. It's good for physical health. the risk of transmission is like exceedingly rare.
It's been 14 months of not being able to get adults playing team sports.
Christy Harold is the president and CEO of the Sports Social Club, which runs intramural sports for adults. She says there are many sports that are one-on-one, where people can stay distance, and she says they can modify the rules for many other sports to ensure people are safe.
If you want to be playing soccer or ultimate frisbee as an example, and there's a chance that you might be within 2 meters of someone for a few seconds, we can be playing those sports wearing masks.
Now, we should point out that there are some differences between last summer and heading into the warmer weather this year, and that's the newer variants, which we know are much more transmissible. But still, doctors say there is no evidence to suggest that you are more at risk this year when you're in the outdoors, as long as you take the proper precautions, wearing masks and physically distancing. Greg Ross, CBC News, Toronto.
A construction site, for condominiums in downtown Toronto. How could this possibly be essential right now?
With ongoing COVID-19 outbreaks at workplaces in Ontario, what defines a workplace as essential? After the break, we'll look at what makes the list and why some experts say the definition needs to be narrowed. Welcome back. We've been hearing the term essential workplace a lot, but do you know what it means? As Ali Chiasson reports, while the province says it's not that easy to define, one of their medical experts says it's urgent that they do so.
What is essential? It turns out a whole lot. By now you know about groceries and pharmacy. Any essential in-store shopping has capacity limits, otherwise only curbside pickup is allowed. But all along the supply chain, many manufacturing facilities are allowed to stay open and operating. Under the provincial regulations, a lot more than food processing plants would be deemed essential. According to the rules, among the facilities that can remain open in a shutdown zone are businesses that supply businesses or places that are permitted to open within Ontario.
We still have these open issues about, what is really essential work and what is not.
Dr. Peter Uni is a member of the province's Science Advisory Table. He says the list of essential workplaces, including construction sites, needs to be narrowed.
If something is, a construction site, for condominiums in downtown Toronto, how could this possibly be essential right now? There are some luxury goods out there that are continuing to be produced. How is this possibly essential?
Among the list of 56 companies with outbreaks in Toronto is a facility that makes sports jerseys. Another makes office furniture. Dr. Uni was close to resigning over this very issue, and the fact that the province hasn't budged on paid sick days for the workers.
It's heartbreaking.
Considering workplace outbreaks continue to happen, will the province have another look at what it deems essential?
I can't give you a yes or no.
Ontario's chief medical officer did not give a definitive answer, even though I asked his medical opinion.
Well, like the best case scenario modeling that is presented to us is based on making the essential list as small as possible. Do you think that it is, or you're saying that it's in flux?
I would agree that we should try and make it as small as possible. If they're non-essential, then they should be closed. If they are essential by definition, then we'd have to look at the cost of closing those.
There is a workplace inspection blitz happening in the meantime, while the province continues to consider taking a look at revisiting what is deemed an essential workplace. Ali Chiasson, CBC News, Toronto.
Cloudy with light rain throughout the evening and the chance of showers overnight. Currently, it's about 8 degrees downtown. Let's go back to Colette now with a look at your long-range forecast. And Colette, I thought we were in the clear when it comes to snow, but April can be quite unpredictable with a dip in temperatures this week.
Thanks, Kelda. Yeah, essentially what we're really seeing is that kind of through this midweek period, we're going to have conditions quite a bit cooler than what they were today. That's for sure. We had some high teens, and we're looking at with this cold front going through some of the wet weather, and the wind's a little bit blustery just as it passes. And that means cooler air moves in for tomorrow. A few sunny breaks, mostly though it's a cloudy day. And then we get another system that as it develops kind of skims to the south of us. And that means Tuesday night into Wednesday morning. It does look like maybe just a few centimeters, if that, towards the GTA in terms of the track. If it pushes further north, it becomes more of a snow event for us. But I would still plan that Wednesday morning could be a little slower on the roads, especially anyone kind of taken off guard by this. So here we go. The temperatures from today, highs, I said, in the upper teens, 17 Toronto and Kitchener and Windsor at 18, same as St. Catharines, and for the nation's capital, we're going to take a good 10 degrees or more off of that for the high for tomorrow. So that's because of this cold front going through that leading edge of a new air mass, and this one is a cooler one. After it passes, we're actually seeing those showers kind of drying up, so give it another hour or two and we'll really be seeing that packing off towards the east. But we have that cloud cover left behind. A few sunny breaks are certainly possible, even especially towards the morning hours before it really fills back in. Thicker cloud deck back towards southwestern Ontario with the development of this next system that's moving in. Now, there wasn't much agreement between the models, but what we're looking at now is it kind of coming together that track stays further south. So that's why I'm saying maybe 5 centimeters or so into the Niagara region. I'll keep fine-tuning that, and just kind of a dusting here, 407 and south, and north of that you probably won't see anything from that particular system. We'll get into clearing behind that. That is Tuesday night into Wednesday morning, and then that clearing into the day on Wednesday. But what we're going to be looking at is some colder air till Thursday. Tonight, your temperatures southwestern Ontario, and then a look at that cooler air for tomorrow. And around the Golden Horseshoe, the numbers look like this, just a bit above freezing. Wait till the next night. It won't be in those lows or those highs that I said, like I said, 10 degrees. All right, Wednesday's high just 3. And there it is. Through midweek, and then Kelda, the temperatures go right back up as we head towards the end of the week.
Sounds good. Thanks so much, Colette. A quick but historic moment today, worlds away. The first ever controlled flight on another planet. We'll have more on Ingenuity's Little Hop next.
I'm Ismail Alpha, host of Metro Morning. Well, the federal budget was tabled earlier today. So coming up on tomorrow's program, we'll get down to the brass tacks with Finance Minister and Deputy Prime Minister Chrystia Freeland. Join me weekdays from 5:30 till 8:30 for Metro Morning on CBC Radio 1.
Finally tonight, it was a brief hop, just like Neil Armstrong's, but the short step by NASA's tiny helicopter on Mars is arguably one more giant leap for humankind. Now, this quick flight by Ingenuity is humanity's first ever powered and controlled flight on another planet. The chopper hovered 3 meters above the surface of Mars for 39 seconds. The milestone was met with a resounding applause and cheers here on Earth, but being more than 280 million kilometers away, it did take a few excruciating hours before NASA's ground control learned that the test was a success. And that's our show for you tonight. Thank you so much for watching. I will see you back here tomorrow night at 11. Have a great night.